Hi everyone, today we're going to talk about polycystic ovarian syndrome, or commonly called PCOS. I'm Dr. Leong from Alpha IVF. Let's talk about PCOS and we jump straight to IVF. Let's talk about IVF. Let's talk about PCOS and IVF. Can you do IVF if you have PCOS? Well, you can, obviously you can. What is the difference if you do IVF if you have PCOS versus if you do not have PCOS? Now in PCOS, normally if you do IVF, even with low dose medications, you will probably produce a lot of eggs, more than the general person. But generally the quality of the eggs may not be that good. Even if you have quantity, the quality may be an issue. But in IVF, of course, we will filter, we will select good eggs to inject with husband's sperm. So in a nutshell, you may have quantity, but you may have so much quality, so the fertilization at the end of the day may be a bit lower than the general population who does not have PCOS. Once the eggs are fertilized, you get embryos from the fertilized eggs as in normal IVF. There's no different. The only difference now is the transfer. Now, we know that in PCOS, if you have to do a fresh transfer in IVF, your risk of getting ovarian hyperstimulation syndrome is high. Ovarian hyperstimulation syndrome, or OHSS, is a condition whereby there's a shift of the fluids in your body, where the fluids are supposed to be inside your veins. They leak out and cause problems. For example, fluid being trapped outside the veins in the tummy, may cause bloatedness in the chest, it may even cause difficulty breathing in the lungs, may even be life-threatening. So back in the day where people do IVF for patients with PCOS, they tend to run a high risk of getting OHSS and the associated complications, which sometimes can be quite life-threatening. So in modern day IVF, of course, we do a lot of embryo freezing. So a good doctor will not overdose you with injections so that you do not predispose you to high chance of OHSS. And after the collection of the eggs, the egg pickup, there are certain medications that we can give you to minimize the risk of getting OHSS. And the most important bit is the embryos will be frozen, so there's no fresh transfer. So theoretically, once we freeze the embryos, we do not transfer back the embryos, you will have a period roughly about 10 days after the pickup of eggs in IVF. Once the period comes, your risk of OHSS should disappear. You should go back, you should feel normal again, so there is no further risk from then on. Then later on, when the doctor chooses to do the frozen embryo transfer, meaning that you already have your embryos, you're going to transfer it later on, there will be no risk of getting OHSS because you're doing the transfer on an unstimulated cycle. Okay, some may ask, in PCOS, generally speaking, you have a lower chance in terms of fertility. So how about with fertility treatment? Is it still going to be any worse than someone who doesn't have PCOS? As mentioned, you have more eggs, but the quality may be bad. So the selection of embryos in IVF may be a bit lower in the end. But as long as you have good embryos in modern IVF, once you have good quality embryos, if you can even check the DNA of those embryos now to make sure that they are totally normal. If you transfer normal embryos, the chances of getting pregnant should not be any less than someone who does not have PCOS. However, if you do have PCOS and you do a transfer, or you get pregnant even naturally, your risk of miscarriage is slightly higher. because of the hormonal imbalances you have previously, the metabolic changes in your body, you tend to run a higher risk of miscarriage. Any good doctor who will be seeing you in your pregnancy, whether it's through IVF, IUI, or even natural pregnancy, if you have PCOS, they generally will give you a bit of support. In IVF, for sure, we'll be giving you support in terms of hormones, certain hormones to take orally, to insert vaginally, injections, to minimize miscarriages. So it's something to take note of. Now, as you know that in PCOS is not only problems with your ovulation, there's also metabolic changes, hormonal changes in your body, so that you put on weight a bit easier, you've got some excessive hair growth, not so healthy skin, that kind of thing. So what can you help in general on your own? So losing weight helps, you know? So exercise, healthy diet, watch what you eat, make sure you burn off those calories in exercise. All of these will help to restore your hormonal balance. So every bit helps. Certain pills like metformin, which is generally used to treat diabetes, can be used, it's an oral pill taken orally, to help minimize the symptoms or improve the condition for women with PCOS. It may help ovulation come at a more regular period, may help women lose weight a bit more easier, and may balance off the metabolism in women with PCOS. So metformin can be used as well, but please consult your ONG specialist regarding this instead of taking it over the counter. So some may ask, how did I get PCOS? Is this something I did wrong or something like that? The truth is, no one actually knows. There is some evidence to show that it may be familial. Familial meaning that, you know, it runs in a certain family. You know, the females in the family more often will have this condition. But I'm not saying it's for certain it's genetic, but there seems to be a familial trend. It can come spontaneously at any point in time. You may have it in your teenage years, as a school-going teenager. You can even have it at midpoint of life. You know, you're okay all the while, and suddenly in your 30s, when you're trying to start a family, and suddenly PCOS comes in. It may even start in the later decades of life. So no one knows the exact cause, but it can happen at any point of your fertile period, and it can also disappear in that period as well, you know, without any signals. For after a couple of years, it may be back to normal again. Is it because of certain foods that you've taken, certain diets? No, I can't say it's because of that. But if you have PCOS and you do not watch your diet and you take foods high in calorie, fattening foods, you may exacerbate or you may make things worse. Well, I hope all of you ladies find this video helpful. Until next time, take care.